Okay. Yeah, as I said, welcome everyone. Really nice to see each of you here, and people still coming in, which is fine. Of course, we can add you while we're having this webinar. Let me just briefly, very briefly, because we have a full program, introduce myself. My name is Kim, and at the beginning of 2020, I started as a junior coordinator at DCDD, the Dutch Coalition on Disability and Development. And I will be facilitating this webinar today and introducing the many interesting speakers we have giving presentations on disability, inclusive data and monitoring. Just to quickly mention to you, DCDD, as you probably know, but it's a Dutch coalition for well, Dutch organizations, but also individuals who work on disability inclusion in low and middle income countries. And also the individuals on just finding the topic very important or working in that sector. And we mostly do this through lobby linking and learning, and which is one of the webinars today, of course. And as I mentioned, we are hosting this webinar together with the platform Partos, Leave No One Behind. And I can mention a lot of, or tell a lot about it, but I think Annemarie, who is also here on behalf of Partos, can do that much better. So Annemarie, I would kindly give the floor to you to tell a little bit about that, please.
Thank you, Kim. I'll be very brief too. My name is Annemarie Heemskerk. I work for Partos, which is the Dutch Association of Development Organization. I welcome you also on behalf of the Partos Leave No One Behind platform. The Partos Leave No One Behind platform is a platform of organizations and individuals, members and non-members of Partos, who are dedicated to inclusive policies and practices and to joint learning about these topics. Some of you may know that this platform was coordinated by Annelies Kuipers, who unfortunately left us, but we as Partos are committed to continue to support the platform. And I would therefore invite you to suggest us any new topics that you would like to work and exchange on for the next session. Then please send an email to Partos. This session is fully prepared by DCDD, and I thank Kim for all the hard work done, and I'd like to give you the floor.
Yes, thank you, Annemarie. Really interesting to hear also about the Partos platform. As you currently see on your screen, the program for today is, as I said, it's quite full, but we have a lot of interesting things to cover. So the first hour, we will basically give a bit more of the theory and the theoretical background behind the Washington Group questions. First, we have Daniel Mont presenting. He gives an opening with the introduction into disability data monitoring, so to say, by focusing on these Washington Group short set of questions, but also what they are and why they are important and useful, but maybe some critical notes as well, of course. And after that, Annet Lukkien will give a short presentation about the importance of disability data and monitoring in humanitarian aid, and she is telling that on behalf of Dorcas. The second hour we want to make way more practical by giving really more information about how it works and how you can apply the Washington Group questions, which I think is especially interesting for those of you joining from organizations, deciding or thinking of working with those questions maybe. Here we first have Praveen Kumar G from VSO International talking about how VSO has started to use the Washington Group questions in their education programs, as well as what the result and impact is of using these questions. And then last but not least, we have Daniel Mont again giving kind of tips and tricks on how to get started with these questions. As I mentioned, the program is quite full, but we have, after each presentation, around 5 minutes for people to have, well, kind of a Q&A, so questions and answers. And it's also nice to see that many of you actually send in questions with the registration form as well. So we can also have a look at them and see what we can use for that and ask the presenters, of course. Let me see. Oh yeah, afterwards we will of course share the recordings of this webinar as well as the transcript of the closed captions or the subtitles now that we have as well as an option. And Linda, who is a research intern at DCDD, will make kind of the notes on the Q&A that have been asked today, which we will send as well as more of a practical guidance notes on disability inclusive data and monitoring that are hopefully good for you organizations or for people for inspiration to use. Well, this is kind of a lot of information, but maybe important before we get started. I hope all is clear. If there are any questions, please share them in the chat. Since we have a full program, I think it will take a bit of too much time to have people really ask them themselves. So in case anything is unclear or you have a specific question for the presenters, just share them in the chat. And we will try our best to answer them, of course. Also, one more kind of request to, if you're not talking, to switch off your audio because it might be a bit confusing for others to listen to. So only if you're telling something, please put on your speaker, your audio. So without further ado, I will start by introducing the first presenter we have today, which is Daniel Mont. Daniel is a co-president and founder of the Center for Inclusive Policy, and you can kind of say he's a data expert. And within this role, Daniel also advises governments, NGOs, UN agencies, and what more on monitoring disability inclusion through data disaggregation and research. So Daniel will start off with the first part of presenting more into the introduction of the Washington Group questions. So Daniel, I would like to give the floor to you. And also, of course, if I maybe forgotten about something in this introduction, please feel free to add. And good luck. Thank you.
Hello, everyone. It's nice to be here. And let me just get my screen set up. So Kim, is that all set? You can see it?
Yes, I can see. Oh, well, not yet. Sorry.
Okay, can you see it now?
No.
Are you still sharing your screen?
No, and I think Hanneke isn't
No,
either.
I'm not sharing anymore.
It worked before. This is the,
I can see you. I can see you, Daniel.
But the presentation.
The presentation.
Ah, no.
If you, let me see. Ah, yeah, I see something happening. Yes, we see Zoom now and the presentation. Yeah.
Okay, great.
Perfect, thank you.
Okay. Sorry for that glitch.
No worries, no worries.
So, yeah, so today we're going to be talking about disability data. It's a big issue. But luckily, I can happily report that a lot of progress has been made over the last several years, and we really have a way forward on how to collect good quality data on disability that can support inclusive policies. So let me just start off very briefly. Why do we need disability data? Here I might be preaching to the converted, but people with disabilities face a high degree of exclusion and vulnerability. And by collecting data, we can both raise awareness of this issue and also help develop policies to foster inclusion. Because people with disabilities face exclusion in all areas of life: education, employment, access to healthcare, family life, civic life, sports and leisure, across the board. Doesn't matter what part of life you're talking about, there are barriers that are excluding people with disabilities, and this leads to serious consequences. By any outcome measure that we have that tries to describe people's well-being, there are gaps between people with and without disabilities, whether we're talking about poverty, health, life expectancy, violence, social exclusion, humanitarian crises, which we'll be talking about a little bit more later this hour. So luckily, the world has been taking action on this. The Convention on the Rights of Persons with Disabilities was adopted in 2006. It had the highest number of signatories in history to UN convention. It was most rapidly developed. It was also the first convention which wasn't just a statement of rights, but was also a development document that the world has really taken to heart and is acting on. And one of the key foundations of the CRPD is that it views persons with disabilities not as objects of charity, but as subjects with rights. The purpose is not to say, oh, those poor people with disabilities, we have to help them out. No, it's those people with disabilities are full members of society. They have the same rights as everybody else. And it's our responsibility as a society to make sure that everyone's human rights are being met. And in the CRPD, it points out very specifically in one of the articles, the importance of data, the role of data to ensure this full participation. And it says that data should be disaggregated as appropriate to help assess the implementation of states' parties' obligations to not only find the show those gaps, show the situation of people with disabilities, but also to identify the barriers faced by people with disabilities. Because if all we do is show that people with disabilities are worse off, and we don't collect information on the barriers that are creating that situation, then we won't know what kinds of policies we should be developing. And this is also noted in the Sustainable Development Goals, the 2030 Agenda, which is leave no one behind. Well, you will leave people behind if you don't collect data on them and understand their situation. And so the role of data in the SDGs primarily is the disaggregation of indicators, comparing outcomes between people with and without disabilities to see where those gaps are, to see where policy needs are. So in what ways do we use data? And this is really important because I see people very often saying, oh, we need data. And they're running out and they start collecting data before they really stop and think about, why am I collecting data? What's the purpose behind my data collection? How am I going to use the data that I'm collecting? If you don't know specifically how you're going to use the data that you're collecting, there's a good chance that the data you collect will be insufficient or inappropriate and will not be as useful. So you really need to hone in on that before you start collecting any data. And there's 4 basic purposes for collecting data. The first is to raise awareness by documenting the scale and type of exclusion that people with disabilities face, showing that there's a problem to be addressed. The second reason is then to develop policies to address that exclusion by uncovering the barriers that create it. And then once we decide what we want to do, then we have to monitor those programs and policies. Are they being implemented in a timely, good fashion, the way they were designed to be implemented or not? And then finally, the last stage is, okay, we've implemented them. Are they useful? Do they have the outcomes we want? We evaluate them to see what are good practices. And each of those 4 purposes sometimes requires a different approach to data collection, either in what questions are being asked, what tools are being asked to use them. Is it administrative data? Is it survey data? Is it census data? Is it qualitative data? Once we figure out why we're collecting the data, we then know how we can go about collecting the data. Disaggregation, of course, I mentioned it already. It's the big thing, and it's a very big word, but it's actually a very simple concept. All disaggregation means is we look at an indicator for one group compared to another group. So this is a hypothetical example here of percent employed. We take the population, we divide it into people with disabilities and without disabilities, and we compare their employment rates. So in this chart here, we see people without disabilities are employed at about, 80%, and people with disabilities are employed at 35%. So there's a gap, which means that the goals of the CRPD are not being met. The closer these 2 bars get to being equal, the more the goals of the CRPD of equal participation and equal enjoyment of human rights are being met. But to disaggregate by disability, we need a clear definition of who has a disability. It's really easy to say, oh, we're going to divide people up into those with and without disabilities. That's the easy thing to say. The more complicated thing to do is to figure out how we're going to put people in those 2 groups in a way which is internationally comparable, if that's important to us, in a way that's consistent, in a way that's understandable and in a way that's relevant to our reasons for disaggregating the data. And if we don't step back and do a good job of dividing people into these groups, we're going to get very confusing results. And if you look at disability estimates from around the world, we see that they vary tremendously. They vary within a country, in between countries. For example, 2% in India, 15% in the United States. What does that mean? Do we really think the US has 7 times as much disability?
Facilitators were present at the lusting site.
And then it varies within a country across time. So the 1990 Brazilian census had a 0.9% rate of disability. The 2000 census had a 14.5% rate of disability. We don't really think that disability increased, 15-fold over those years. Something must have happened, right, in terms of how they were collecting the data. And then it varies within a country across different tools. The Australian census had a 17.7% rate of disability, and with at approximately the same time, they did a disability supplemental survey, and then they had a 6.7% rate of disability. And when people see these numbers all over the place, they think we don't know what we're doing. What are we collecting, and why do we get these differences? Well, they vary for a variety of reasons. One, the methodology for how you identify people with disabilities, right? For example, Brazil, we went from 0.9 to 14.5. Why? They changed the questions. Instead of asking, do you have a disability? They started asking a longer list of functionally based questions. Therefore, they started identifying more people. Also, the threshold for what constitutes a disability can be different for different purposes. Right? Disability, as I'll talk about in a little bit, is not really a binary variable. It's not really true that there are 2 kinds of people in the world, people with and without disabilities. There's a range and there's a continuum. Where I draw the line separating who has and who doesn't have a disability might differ depending on my reason for identifying people with disabilities. That's going to get me a different rate. I'll talk about that a little bit more. And finally, the social and cultural understandings of what constitutes a disability can vary from place to place, and that will affect how people are identified. So before we talk about data collection, how we're going to go about identifying these people with a disability, let's take a step back and get a clear sense of what we mean by disability. So disability, according to the Convention on the Rights of People with Disabilities, according to the social model of disability, arises from the interaction between persons with an impairment and barriers and lack of support, which may restrict their participation, right? It comes from those 2 things together. So we have persons, and those persons have various characteristics, gender, age, ethnicity, and they have impairments. And there's the environment, and there are barriers to participation in the environment, and there are supports that promote participation. And it's that interaction which creates disability. If the supports are there and there are no barriers, then disability in the social model sense doesn't occur. So how can we capture this with data? Now, the social model is very useful. I mean, it's very important in the sense that it puts the focus not on fixing the person, but on creating an environment which is truly inclusive. And that really informs policy in a different way. But how can we capture something so complicated with simple, understandable questions on a survey questionnaire, right? I can't put on a questionnaire. Do you, because of an impairment that you have, are limited in the kind of participation that you do because you face barriers in the environment? That question on a survey would give you nonsense data. And as I said, it's further complicated by the fact that disability really exists along a continuum. So here we have a graph of something called an activity limitation score. Now, the activity limitation score that a colleague of mine used in one particular article, we had 44 questions. 44 questions of 44 different activities that people do. And they said how much difficulty they had on each of these 44. We take all this information and...
Daniel, sorry, can I briefly interrupt? I feel like maybe it's your shirt or something, but there's something that is with the sound. We hear a little bit of a background.
Oh, okay. I'll hold my mic up here.
This is better. Yeah, thank you so much. Thank you.
So, so in the activity limitation score is a number, it goes from 0 to whatever, 200, that describes how much limitations people have in their activities. If they have a 0, then they had no difficulty doing any of those 44 activities. And if they had the maximum score, they were unable to do any of those 44 activities. And when we graph something like the activity limitation score in a population, we don't get, you know, one lump of people not disabled and one lump of people disabled. We get a smooth curve like this, where there's lots of people with some difficulties doing a little bit of stuff. And then the more and more activity limitations a person might have, the fewer and fewer people have those, okay? But now now someone comes to you and say, I want you to disaggregate data by disability. Well, you have to draw a line on this graph. You have to say to the people to the left of that line, don't have a disability. To the people to the right of that line, do have a disability. And where I draw that line is going to affect two things. First, the number of people with a disability, but also the disability gaps I find, right? Because the more I move that line to the left, the more I conclude people who don't have as much severe limitations, the better outcomes they're going to be having, right? So if I draw the line all the way to the right, I have a few people with big disability gaps. And if the more I draw a line to the left, I have lots of people with smaller on average disability gaps. So we have to think about, where do we want to draw the line for what purpose? And so past data collection efforts have tended to ignore these issues, which have led to poor quality data. And beyond being poor quality, as I've said, they have estimates that are all over the place, which undermine people's confidence in what they're observing, right? How can I believe the numbers I'm getting if they keep changing widely from one survey to the next or one country to the next? So the most common question that used to be, luckily this question is disappearing slowly from a lot of surveys, is do you have a disability? This question tends to get the smallest percentages. Okay, when you see the really small percentages, like Nigeria had a survey, it was 0.05%. Bangladesh had a survey, 1% of the population. When you see numbers like that, it generally is because the question being asked is, do you have a disability? Disability is associated with stigma. So often people don't want to say that. Or they think of the word disability as being something very severe. So they say, oh, yeah, sure, I have problems, but I'm not disabled. And therefore we miss people with more moderate disabilities. And we tend to miss older people too, because an older person might say, well, of course I have difficulty walking. I'm 85 years old. What do you expect? I don't have a disability. I'm old. But really it's age, which is the cause of the disability. So then other countries started saying, okay, we won't ask that question. We'll ask, do you have with a list of medical conditions? Do you have epilepsy? Do you have autism? Do you have cerebral palsy, et cetera, et cetera? But this also identifies people. First of all, you're always going to have an incomplete list of conditions. There are so many conditions to have. Second, only those with education and access to doctors might know their diagnosis. They may not know they have cerebral palsy. I mean, if they have never received that diagnosis. And importantly, there's a big variance among people with the same diagnosis. For example, cerebral palsy. Two people with the same medical condition might face very different levels of difficulty doing various activities. Whether it's walking or talking or whatever. And so when we use these different methods, we get really different results. In these low and middle income countries on the right, you see very low rates because at that time, you see the years are old. A lot of these countries have improved their disability data collection. But when they were using those questions, they get very low rates. And countries that were using more functionally based questions that we'll talk about in a minute about what kind of difficulties people have doing things, they tended to get much higher rates. Okay, so for example, example of a problematic question from the 1990 Zambia census, which has since been improved, as we'll see in a minute. They asked, are you disabled in any way? And then what is your disability? And they had blind, deaf, dumb, crippled, mentally retarded. So this is how they describe disability, which not only has offensive language, but also doesn't take into account that continuum that we were talking about. And so they got a disability prevalence rate of 0.9%, okay? So we want to improve the question. So the social model of disability can be a guide to disability data collection. Okay. But the challenge is to write a short set of survey questions that can accurately capture the complexity of disability, right? It's impossible to do that. Yet, I mean, our survey questions have to be short, clear, and precise. So how do we go about crafting such a question? Well, the place that the Washington Group on Disability Statistics started with was the International Classification of Functioning. Now, in the International Classification of Functioning, there are 4 levels of functioning. The first is body structure, function and structures. Body functions are physiological functions like moving your arm, vocalizing a sound. Then the next level is activities, where we combine body functions to do a task. So walking is an activity, okay? It requires me to use my legs, it requires me to breathe, it requires a sense of balance. I combine all those body functions and I do an activity. And the last level of functioning is participation, which is the involvement in a life situation, fulfilling a social role, going to work, going to school, having children, etc. In order to do these things, I have to combine activities, right? To go to work, I need to be able to move, communicate, learn and remember, etc., etc. And that's the main goal. Okay, and this is a diagram of the ICF model. We see the 3 levels of functioning: body function, activity, and participation. And we see they're affected by health conditions. Impairments affect those things, but the relationship between those things are affected by personal and environmental factors. If I have difficulty walking, how does that lead to participation restrictions? It leads to participation restrictions because of the environmental barriers or the lack of personal resources that I have, okay? So as you see, disability does not appear in the ICF. Disability emerges from the ICF by the way various barriers affect the relationship between these functioning levels. And so,
sorry, Daniel, can I just ask you one more time for your
t-shirt?
Sorry,
I'm sorry.
Yeah.
I'm sorry.
Thank you so much.
I let it go. I'm sorry.
No worries. Thank you.
So just to explain how this works, here's a story of a boy. As a result of a spinal cord injury, Mahmoud lost strength in his legs. Now he has difficulty walking, especially since he never received rehabilitation services. This, combined with his lack of access to a wheelchair and no accessible public transportation, has prevented him from being able to find employment. So how is this captured in the ICF? The catalyzing force is a health situation, right? It's his injury, and that affects his body structure and function. This impacts his ability to walk, which is an activity, but the relationship between the injury and the ability to walk was affected by his access to rehabilitation services. It's also, and his ability to walk, and his difficulty walking will lead to difficulties in participation if there's barriers in the environment, like no ramps or discrimination or lack of access to a wheelchair. So does Mahmoud have a disability? According to the social model, it's his lack of participation which is the disability, since it emerges from the interaction of his impairments in the environment. But how should disability be defined for the purposes of data collection? Okay, and that's what the Washington Group had to figure out. Okay, so back in 2001, there was a big meeting convened to try to figure out what was going on with the state of disability data. And the UN Statistical Commission created the Washington Group on Disability Statistics. And it has the unfortunate name of Washington Group because the UN Statistical Commission always names their city groups on statistics for various topics, like there's the Rio de Janeiro Group on poverty, the Titchfield Group on aging. They name them after the first city they meet in. So that's why it's called the Washington City Group. But it's really a group, the members of the group are representatives from national statistical offices from around the world. Over 130 countries have at one point had members of the Washington Group. And the goal was to address the need for population-based measures of disability, foster international cooperation, and produce internationally tested measures to help countries incorporate disability in a better way in their national statistical systems. as I said, there's representatives from all over the place. The Secretariat is in the National Center for Health Statistics in Washington, but the working groups have inputs from all members. And all the documents, all the testing, all the presentations from the 20 years of meetings, they're all on the website. So everything that we've done, that's done is completely transparent. So the Washington Group approach was, okay, we're going to incorporate all, disability isn't complex. It incorporates all components of the ICF. The language of disability, the word disability is not specific. People interpret it different ways. So the decision was that someone was, that for the purposes of disaggregating data and for the purposes of looking at prevalence, someone is considered to have a disability if they have activity limitations that put them at risk of not participating because of barriers in the environment. And this is sort of lines up with the goals of the CRPD, right? We want to say, we want to look and see, are the people at risk of not participating? Are they participating? So we're not looking at disability as the final end product of the social model, those people who are being excluded from society. We're looking at the people who have impairments, but we're not looking at the body function level, because that is immense, and body functions and diagnoses play out with different people in so many different ways, complicated ways, that the idea was to focus on the activity level and say those are the people, that's where disability arrives. So we look at the ICF model, and the Washington question focuses on identifying those with difficulties doing certain universal basic actions. And that's the definition of disability. I better speed up here. Okay, so exclusion results from many different types of impairments. The Washington questions don't ask about these. They only identify people who are at risk. Okay, but these questions are not complicated. It's the concept of disability is complicated, but the idea of difficulties doing these basic actions don't require complicated questions, which is good, because complicated questions don't work on surveys. And so I assume many of you have seen the questions. They basically say, do you have difficulty seeing even if wearing glasses? Do you have difficulty hearing even if using a hearing aid? Do you have difficulty walking or climbing steps? Remembering or concentrating, self-care, communication. And I could talk like an hour about each one of these questions and the various versions of them and test it and why they were there. So if you have questions about them, sometimes people say, where's learning in this? Or what if I don't? What if I never heard of a hearing aid? And we can talk about all those technical things if you want to. But the important thing is the response categories are no, some, a lot, or cannot do. So it's not a yes/no question. So we're trying to capture that range of disability. And we find that for international comparability, while people who answer cannot do or a lot of difficulty across countries tend to report the same kinds of issues. The sum category is more complicated. There's more variance across cultures. And we can talk again about the different thresholds using some, a lot, cannot do. There's a lot to talk about. We have whole week-long trainings on this. So if a person answers a lot of difficulty or unable to do to any of the 6 questions, that's when they're identified as having a disability. But more detailed analysis can take into account some difficulty answers as well. We have that information, and there are ways to use it. So remember back to Zambia when we had that 0.9%, because you had to say, do you have a disability? Well, in 2006, Zambia used the Washington Group questions, and the estimated prevalence was 8.5%. Okay. So by using the Washington Group questions, we can estimate the prevalence of disability, including the patterns of prevalence. For example, is it associated with age, gender, place of residence? And we can disaggregate data. We can use the Washington Group questions to divide people up into people with and without disabilities and see if there are any gaps in our outcomes. Okay. So like with anything, there's advantages and there's limitations. So the advantages to the Washington Group questions is it's a functional approach. You know, it fits in into the ICF, it fits into the idea of what's going on in the social model, and it's tested in many countries, low, middle, and high income. It's designed specifically to be internationally comparable, and I can talk more about that, what we had to do for that. And it identifies the majority of people with disabilities. It also can be easily added to existing censuses or surveys or to project-based data. They take, on average, 1.25 minutes to ask a person. So it's a quick, relatively quick way to capture the majority of people with disabilities for the purposes of prevalence and disaggregation. But there's limitations, important limitations. First, they're not appropriate for children under age 5. They totally don't work there. And they miss a lot of children with developmental issues from age 5 to 18. That's a big drawback. Second, it misses those with psychosocial issues that don't affect communication, cognition, or self-care. In the US, for example, half of the people with psychosocial disabilities are missed by the short set of questions. Half of them are included because they have problems in other areas, but they're not identified as having psychosocial issues, and half of them aren't met. Also, it doesn't address functioning with and without assisted devices. For some purposes, what we want to know is how are people able to function given that they have their hearing aid, given that they have the wheelchair or whatever. Okay, so there are limitations. But the Washington group has worked to try to fill those gaps. We developed an extended set on functioning, which has a whole bunch of questions over a whole bunch of domains that try to get at psychosocial issues and the use of assisted devices, but it's not 6 questions, right? It's over 30 questions, so it takes up a lot more space. One compromise is something we call the Washington Group Short Set Enhanced, which is a reduced version of the extended set. So there, we take the 6 questions on the Washington Group. We had 2 questions on upper body functioning, things like lifting and grasping. And we had 4 questions on affect, 2 on anxiety and 2 on depression. And I could talk about what those questions are if you're interested, because they will capture a lot more people with psychosocial disabilities. And then UNICEF and the Washington Group developed the child functioning module, one for children aged 2 to 4 and one for children aged 5 to 17. And it's specifically designed and it works much better for children. And we also worked with the ILO to develop a disability module for labor force surveys that includes 2 affect questions instead of the 4. They wanted to reduce them to 2, and I can talk about that as well if you're interested. Filling the gaps, there's other tools under development. Some people were concerned that the child functioning module was too long to be used in a school setting. So we're working to create a teacher version, which is a slightly scaled down version of the child functioning module for teachers to use. That's still being tested. There's an inclusive education module that tries to address environmental facilitators and barriers, which is under development. And there's also a working group working on a special set of questions on psychosocial functioning and mental health, which is, again, still in development. So how do we mainstream disability statistics? We identify the important thing is to identify current data collection systems that already exist. There are already lots of surveys, lots of data, lots of administrative data out there that's being collected for the SDGs, for example. If we include the Washington Group question set in those tools, then all the indicators that are already being created can be disaggregated. And this core information becomes available for everyone. It becomes more sustainable. If we can incorporate it in the National Statistical System, we have sustainable data. Sometimes we need a special disability surveys to get it more detail and stuff, and we can talk about when you need a special disability survey and when it's kind of okay to just put something like the Washington Group questions in an existing survey. Again, we can talk about that. But by having a standardized approach, by having a functionally based approach that we use across all data instruments, it's possible to provide comparable data within a country and cross-nationally across different data sets. And these can be used to assess a country's compliance with developmental goals over time. There's a lot of implementation issues that need to be addressed that I'm not going to talk about now. How do you translate the questions? We have protocols for that. When is it okay to adapt them to the local context, and how do you do that? What's the best procedures for interviewer training, for sampling? And then how do you analyze the data? How do you look at type of disability, severity of disability, and various things? And there's lots of material out there about this. There's many resources, documents, question sets, facts, and there's an extensive blog series that talks about many things like, oh, what about long-term versus short-term? Does it really fit with the social model? Is it useful for eligibility determination? No, these questions have a very specific purpose. They have a purpose for, as I said, prevalence and disaggregation. They're not specific enough, reliable enough, detailed enough for something like determining whether somebody should be eligible for disability benefits. They might be accurate enough to try to screen people into whether they should be assessed. We can talk about that too. But a lot of information is available on a new, recently redesigned and improved website. It's at www.washingtongroup-disability.com. That's a lot of information I just went through. Hopefully I didn't go too fast, but I'm very happy. If you have questions or comments, I'm very happy to respond to them. So thank you for listening.
Thank you, Daniel. It was really interesting. Very nice to hear more of just the introduction, of course, into the Washington Group questions itself, but also part of the implications or the implications about asking about disability, for instance, that you mentioned, as well as thinking about really the purpose behind, well, the questions you set up. So thank you for that. I will first have a look at the chat and see what questions people asked. Let me see, I see one from Claire. She said, thank you for this interesting presentation. Do you consider the chapeau or precursor sentence which clarifies that the Washington Group questions are linked to health problems to be an integral part of the question set?
Yeah, that's right. If you look at, just so everyone knows, if you look at the Washington questions, it's often it says at the top, because of a health problem, but that's in there. It all depends on the structure of the survey. Okay, what questions come before it? Oftentimes we don't put that in there if it's, for example, part of the household roster, because the context hasn't been set. But if you just asked a whole bunch of questions about people, about other activities or income or health or other environmental factors, and then you start asking these questions, it might affect how people answer them. So the idea is, well, let's reset everybody and know that what we're trying to talk about are things that are linked to health and impairments. We don't want to know if people have difficulties because of gender or because of something else, right? So it all depends on where. So they're not so that introductory statement is not essential. It's only useful when in the structure of the survey we need to let people know that we're changing the focus of what we're asking about. And there is a blog, I think, in Facts about that on the website that sort of explains that a little more than I just did.
Okay, thank you. I see another one from Betteke. She's asking why the percentage of disabled persons seem to be higher in high-income countries, that she missed the beginning of the presentation, so you might have already explained it. I think, well, correct me if I'm wrong, wasn't that related to the way you asked the questions as well?
Well, there's actually two reasons. One is how you ask the question. So when you ask these functionally based questions, you tend to identify more people. And the higher income countries have tended to use those questions more and sooner. But another important reason is because of the age distribution.
Yeah, okay.
Disability is really associated with age. So if I'm looking at a country where the average age of the population is 28, and another country where the average age of the population is 40, I'm going to have a big difference in disability rates just because of that.
Yeah, thank you. Let's see, another question from Fried Lammerink. The Rapid Assistive Technology Assessment Tool from WHO is also using the Washington Group questions, including the 4 possible answers. After each question, they ask, without the use of any products, wouldn't this be helpful as well?
Yes, and so in the Washington Group extended set, there's questions about with and without assisted devices, right? So the more space you have, the more questions you ask, the more facets of disability you can get at. Okay, so if the purpose is to identify who is at risk, say, of being poor, who is at risk of not being able to work because of a disability, then what we want to know is somebody's functioning without the assistive device, right? Because they would say, if somebody who cannot walk is at risk. Now they may be able to go to work because they have a wheelchair, and they're able to get to work, and that's great. But what we want to know for the purposes of seeing the gaps between people with and without disabilities, we want to know without the assistive device. If I'm trying to estimate, what are the barriers to work, what's the impact of providing assistive devices, how many assistive devices are needed in the population, then I want to be able to ask those questions, right? So it always goes back to the purpose for collecting the data about whether you want to know it with assisted devices or without assisted devices.
Yeah, thank you. The next question by Linda, I think also links to that and what you said a bit before as well. She says, very helpful presentation. Can you briefly explain how temporary disability and lifelong disability is handled within the survey?
Yeah, so we tested this because a lot of people want to ask the question, do these difficulties, have they existed for 6 months or longer? Do you expect them to exist for 6 months or longer? And that sort of thing. Or they'll say, oh, what about somebody who just sprained their ankle yesterday and now they're having difficulty walking, but in a week they're going to be fine, right? So it turns out when we tested the questions, because you never know anything unless you test these things, generally speaking, people who had very short-term issues like the sprained ankle did not report difficulties because of that. Okay, they tended to adjust, But when we ask things like, has it lasted 6 months or more, or 2 years or more, we find that for many people that was confusing. Okay, some people said, well, I haven't been able to walk my whole life. What are you talking about, 6 months? I mean, so that's not what the question's asking. But remember, what's important is not what you think you're asking. What's important is how people interpret the question, which is why we need to we do cognitive interviewing. We test these questions to see how people are interpreting them. Or maybe somebody was in a traffic accident a month ago and now cannot walk at all, but it's only been a month ago. So they say, well, no, it's only been a month. So what we found is that the measurement error from including the phrase about 6 months or more or how permanent it is was much bigger than the measurement error of people with very temporary conditions responding that they had a lot of difficulty, that they weren't able to do things. So the decision based on the testing was although we have errors, because you always have errors with quantitative, with survey data, the results of the testing were that the errors of including a phrase about how long something lasted were much bigger than the errors we got from not having it. And so the decision was to not have it.
Very clear. Thank you. I see many more questions coming in, and I also have some that were asked via the registration form. But I'm afraid also due to time, we have to get to the next speaker. But of course, maybe you're also presenting in the second half of the webinar. Maybe if there's time, we can still treat some of these questions as well. But for now, thank you so much, Daniel. It was really interesting. And thank you for being here, of course. And we'll talk to you later, of course. Thank you. For now, I will introduce our second speaker, which is Annet Lukkien. She works at Dorcas as a humanitarian aid coordinator. And she's also, maybe that's nice to tell, a DCDD participant. And Dorcas is also an organization that is part of DCDD. And moreover, Annet is also a consultant at Inclusion Matters, which is moving communities and societies to become more inclusive and welcoming for children and adults with a disability. Annet, I will give the floor to you and also share my screen for your presentation. And again, as I said also with Daniel, if there is something I forgot about the introduction, feel free to add. And for now, good luck and thank you.
Thank you very much for your introduction. That's great, and it's a tall order to follow such a brilliant presentation that we just heard from Daniel. And my presentation is about the importance of disability data in humanitarian aid. As I've said in introduction, I work for Dorcas Aid International. We are, just briefly something about the organization, we're striving for lasting change for those in poverty or crisis. We're a Christian organization working mainly in Middle East, Eastern Africa, and Eastern Europe. A little bit about myself. Next slide, please.
Yes.
Slide. I worked in the humanitarian aid sector in the 90s, and then I worked with refugees in the UK, and then I worked for 10 years with an organization called LNOB Disability on disability inclusion in the UK, and I've just recently returned back to the humanitarian aid sector and gradually getting to grips with the changes in the sector since the 90s. But as in my other role as consultant, I did some research, and also during my time working with LNOB, I realized a very strong link there is between poverty and disability. And as I was doing research, also for DCDD, it became very clear that there is very limited data available on people with disabilities across the world. And Daniel already told us, showed that already to us. But next slide, please. I also realized that if we want to achieve SDG 1 and eradicate poverty in this world, then we really must also focus on disability inclusion, because such a big percentage of people with disabilities are affected by poverty. As I was moving to the humanitarian aid sector and also finding out the data is very limited, I came across the Washington Group questions, and I think this is a really good starting point for us as a sector to bridge this gap. And as Daniel has said as well, there still is, and I expect we will talk a little bit more about it also in the second hour, there is more to learn and more to improve. But also understanding how it has been developed and taking into consideration the complexity also in terms of what disability is. I fully support the Washington Group questions. I want to start, next question please, with drawing your attention to a guideline that has recently been published end of last year, the Guidelines of Inclusion of Persons with Disability in Humanitarian Action. And in there you'll find 4 important action points, must-do actions: promote meaningful participation, remove barriers, empower persons with disabilities, and disaggregate data for monitoring purposes. And in humanitarian aid, disaggregated data will help us to understand the different ways in which people with disabilities experience a crisis. And we will also be able to monitor their access to assistance. If we don't have that data, how do we know whether actually we are reaching people? At the same time, and I want to say also a little bit more about this, the Washington Group questions are not meant to assess individuals' health or a diagnostic tool to identify what kind of disability people have. So there is also need for further additional data on needs and risk factors, including barriers. This particular document, you'll find a chapter also on disaggregating data and about tools and further tools and links to tools. It also provides insight into context in which data can be used, whether in sudden onset emergencies or a protected crisis, and also information per sector as well. So I think this is a really good tool for you to look at. And have a good starting point to get also further resources. Next slide, please. I want to say a little bit about the humanitarian program cycle from the perspective of looking at data. In the phase of preparedness, and this is really important for humanitarian aid, this is the time where we have, this is the period where we have time to think about accessing data. So mapping available data within the country, contacting disability people organizations and finding more data from them, using that time also to train our staff on using tools for collecting data and translating to tools. Within Dorcas, we are in the process of starting to use the Washington Group questions as of the 1st of January, and we've just recently improved our result framework, and training is needed on this. At the same time, and I will speak a little bit more about this as well when I talk about an example from the field, we also need to think about broader training on disability and inclusion, and that came about also in the must-do actions on participation, empowerment, and removing barriers. In the second phase, needs assessment and analysis, we need the disaggregated data to be able to plan our responses. But also more qualitative information is needed. For example, to identify the very specific barriers that people with disabilities face in that particular locality, the specific forms of discrimination or violence, maybe the specific services that are required and the number of people that require that, the need for communication and beliefs, local beliefs and practices on disability. In the strategic planning phase, we will then use all that data to plan our response. For the resource mobilization, again, we really need the understanding of how to target the right financial resources as well as the human resources. Donors can play a role also in setting targets and making resources available. And we need also to invest in upskilling our workforces. And then in implementation and monitoring and evaluation phases, it is really important that we have collected that data. How can we check if people with disabilities are included in our implementation? How can we check whether gaps or gaps in service provision or accessibility issues if we haven't identified the people with disabilities? So in evaluation as well, it is really important that we have proper data to be able to know that we are on track and achieving our goals. Next slide, please. I want to kind of work it out a little bit further from a story from Beirut. We, as Dorcas, have been very much involved in following the recent explosion in Beirut. And I spoke with my team that is starting to use the Washington Group questions and testing that out. And they reported that as a consequence of meeting people with disabilities and identifying that they became aware of the heightened protection risk for people with disabilities. They were exposed to violence, abuse, neglect, exploitation, but also sometimes harm from humanitarian actors that were not inclusive, that were not providing services, that were responding to the needs of people with disabilities. So it's really important also to realize that the Washington Group questions are not sufficient at operational level. We really need to also involve focus group discussions and look at how can we get people to participate, look at their potential, maybe to volunteer in the community, and how can we reduce our own general barriers, and we need input from people with disabilities. Then for the needs assessment at individual level, we need to hear from people themselves what their needs are and agree with them how we as an organization can make reasonable adjustments to their particular situation. Even though we have kind of removed the general barriers and done as best as we could, there may still be a need for further adjustment to the particular individual's needs. And in that needs assessment, we may come across also other organizations that other needs that actually we cannot provide support with, and we may need to refer to other organizations. They also mentioned the negative attitudes at community and family level that needs to be addressed, and mentioned also the need for training in using the Washington questions, but also in disability inclusion. Also, they realized also the time that it takes for this individual approach and for learning as well as staff, that needs to be taken into account during the resource phase. Next slide, please. That brings me to the end of my brief introduction with some conclusions. I think changing mindsets will need to happen at all levels for all stakeholders. It takes time, but I really feel that starting with data collection will bring about a change, as the example from Beirut made really clear, that my colleagues were starting to become more aware of the needs of people with disabilities. But a change in mindset is needed at all levels in the organization. So Within Dorcas, we are now talking about a strategic plan for the next 5 years and thinking if we say as an organization we want to reach people in crisis, we want to reach people in poverty, who do we actually mean and how can we actually count those people and how can we show that we have reached those people, and we need to make sure that we can also count people with disabilities, and therefore within our M&E team we're working on our result framework, we're working also on policies about disability inclusion, and also training is required for our staff, and that needs to happen during the preparedness phase. So data disaggregation, as indicated in the IASG guidelines, is a really important must-do action, but with that automatically comes also that we need to learn about how can we empower people with disabilities, how can we ensure their participation, how can we remove barriers. And then a final point that all stakeholders need to be included in that. I very much see this as a joint effort in which we all need to learn together. So donors have a role to play in terms of maybe setting targets, making funding available for the individual approach, and as well for helping to upskill the humanitarian aid sector as partners, and then in the widest sense, so this is about INGOs as well as local NGOs as well as DPOs. Together we need to learn from each other, we need to work on this together to cooperate as well, make sure we can refer to each other. And then governments as well, of course, they need to play their role as well in terms of adhering to the law, and also making sure that at society level barriers are removed. So that brings me to the end of my presentation. Thank you very much for your time, and I think I'm overdue a little bit. Sorry.
Yes, thank you, Annet. It was really interesting. Thank you for that. Also about like the importance of training, about the Washington Group questions, and also disability inclusion more in general, and about the fact that it's maybe some sort of, as you were saying as well, a kind of cultural shift as well, maybe in organizations and also for stakeholders in general. Let me check. I was sharing my screen, so I couldn't keep an eye on the chat, but I will have a look at if there are questions here. Let me see. This one is for Daniel still, but I can have a look at one of the questions that was asked in the people that did the registration form. I don't know if this is also related to maybe more in general the for the humanitarian aid sector, but I know that one of the questions was also related to that of intersectionality, and how you in humanitarian aid, if you also include, well, you want to consider all vulnerable groups, minority groups, so to say. Maybe you also include the Washington Group question, how you make sure that with maybe that inclusion you don't leave out other groups. Is there? Do you have a point or a view on that?
Yes, I think it's a very good point that you're making. I think it's really important also to take that into account as well. This is why the individual approach is so important. It really is very important to know whether someone is a female with a disability, and to know also, this is why training is so important, to know that actually there's a real increase at risk of violence. And so that intersectionality is really important, that we take that into account as well. So yeah, disaggregation of data by disability, but also by age and by gender, that is the most ideal objective indeed.
Mm-hmm. Yeah, thank you. Maybe also this is also an interesting one that is also maybe related to not just in humanitarian aid, but also more in general, that we have multiple questions on, well, the privacy issues, so to say, surrounding disability and having that data of people, maybe also some ethical considerations and for who you're actually measuring this. Well, what is your view on that?
Yes, that's a good point, because actually I was meant to say something about this, but I kind of forgot. And just going back to that section where I was talking about the preparedness phase, it is really important that we make sure that the tools, the ways that we process our data is safe and secure, because data about disability and about health is actually sensitive data. And we must be absolutely certain that the way we process that information, how we collect it, where we store it, is kept safe. Because it is, we are holder of that information, and it is always on a need-to-know basis. So this is why I also liked what Daniel said earlier on, that we really need to start with considering why we are asking those questions. What is the need for that information? So if it is about kind of planning our projects and making sure that we are including people with disabilities, then maybe those 6 questions, the Washington Good questions, are sufficient. But if it is about identifying what the particular barriers are for a particular individual, what their risks are, then actually we need to sit down with people and identify what we need to take into account, and how we can make reasonable adjustments ourselves, how we can remove barriers as an organization, or what we need to do to protect that person, maybe refer them on to another organization. So it is very much the aim of how you're going to use that data. What the aim is, that I think you need to consider. Just to start off with collecting as much information as possible is not a good idea in this case, because we're talking about, never a good idea, but in this case, we're talking about people, and something that was really stressed also by my colleague, we need to treat people with dignity and with respect, and with that also comes a real responsibility for holding their personal data. So thank you for asking that question. I wanted to mention that, so thank you.
Yeah, no worries. Thank you, Annet. I'm a bit behind schedule, so as I see there are no other questions in the chat yet, I will just leave it with this for now. Thank you very much. We'll go on to the next speaker, and maybe later, if people still have questions also for you, they can still ask them, of course. So thank you. The next speaker we have is Praveen Kumar G. He is the lead advisor, social inclusion at VSO International. And well, this includes both like technical expertise on diversity and social inclusion, program design, coaching, and trainer facilitator as well on diversity and inclusion. And before that, Praveen worked as the head of programs at VSO India. Let me just double check if Praveen, can you hear me? Are you here?
I think he is muted.
Let me check.
Hello, can you hear me?
Yes, yes.
Yeah, hi Kim. Can you hear me now?
Yeah, perfect. Thank you so much. Yeah, welcome.
Am I visible to you?
Let me check. Not yet, I think, but a big list of names. So let me.
I've turned on the video.
Let me see.
Yes, you are visible.
Ah, sorry, then it's me. Yeah, I see you. I'm sorry. Whoops, that was me. Okay. Sorry, my bad. Yeah, I will spotlight you already. So thank you so much for joining. I will share my screen and then also your PowerPoint.
Okay, thank you. Thank you very much. Yeah, good afternoon and good evening, good night, everybody. I'm saying good night because it's already late evening in India, so people are joining from East, almost evening to good evening. So I'm very happy to join this call, and the Washington group questions are very important. But before I go into that, for those of you who don't know VSO, VSO is an organization. We work on issues of health, education, livelihoods, building safe, peaceful, resilient communities. Approach is primarily working through volunteers, and we call the model as volunteering for. And we work primarily in Africa and Asia, 21 countries. So that's briefly about VSO. And before I get into my presentation, just wanted to share that one of the focus of my work has been also to look at research and looking at data. Data on disability. So basically, we've been talking about disaggregated data, and like Daniel said, even the UN Convention on Rights of Persons with Disabilities and other covenants mentions the aspect of disaggregated data. So it's very important. Kim, if you can go to the next slide.
Yes, thank you.
So in VSO, our focus is disability. So disability is one of the key priorities. We aim to reach 5% of people with disability in all our programs. So as I said, be it health, education, livelihoods, and we call it resilient and peaceful communities. Our focus is reach to 5% of the total target. Total target reach 5% of people. And we also believe that disability inclusion is key to achieving the sustainable development goals and ensuring that no one is left behind. So focusing on education, so the goal 4, which primarily talks about inclusive education, it's very important that we reach out to marginalized communities, vulnerable groups, and children with disabilities are definitely one of them on priority. Next slide, please. So some of the experiences what we have so far, and I'll be sharing through this presentation, is we have adapted the Washington Group of Questions as a mechanism through our monitoring, evaluation, and learning process. So we call it as MILE, wherein it's now embedded as part of all the program design, research, collection, or monitoring evaluation processes. We use child set of questions as appropriate in inclusive education. So earlier, as Dan was mentioning, that the child set of questions is lengthy, where we have 30, 35 questions at some of the more in-depth aspects of whether children with disabilities have assistive devices, what are their other supportive needs, requirements, and so on. So that's something which we definitely encourage to use. And so far the experiences have been positive, and it has enabled us to primarily identify children with disabilities across our programs and plan for appropriate interventions. So as part of this presentation, I'll speak about 3 of the countries where we used the Washington. In Nepal, for example, so the project is called Engage, empowering a new generation of adolescent girls in education. And we administered the Washington Group of Questions in the year 2019. The aim here is to empower girls and marginalized children, and particularly children with disabilities who are out of through formal and non-formal education and employment, so that they're able to identify appropriate transitional pathways, improve parental attitude, and improve attendance of children with disabilities. So this is the kind of focus. But within that, we then looked at how the Washington Group Questions was used. We used it across 3 districts, which is basically Parsa, Sarlahi, and Banki districts of. So next slide, please.
Yes.
And in the process, we basically had to train enumerators. There were 54 enumerators who were trained. They then went to the communities, collected the data, data analysis was done, and so on. And the main findings, what we had was, it helped in identifying functional limitation amongst children, and 278 of 4,562 children were identified as those who had difficulties. So that is roughly around 6%. So 94% reported sometimes difficulty or no difficulty, but 6% of them reported cannot do at all and a lot of time. So that's one part. Again, there we had, this helped us to plan for appropriate interventions like bridge course, provision of assistive devices, creating alternate materials, trainings, and also counseling, and then linking them back to the school. So the identification helped in a way. Next slide, please.
Yes.
Going to Rwanda, similarly. Here we used the Washington Group of Question as part of the Building Learning Foundations, which is called the BLF initiative. This is primarily DFID, now HCPO. And here we actually looked at in 10 schools. So the Washington Group child set was administered in 10 schools, 2 schools in East District, 5 of the districts. We looked at 5 districts. In Rwanda, there are 30. So the main aim here is primarily to look at identifying the children with disabilities, but also looking at what is the prevalence, because we are talking about 30 districts across the country, and doing a sample can give us the prevalence to some extent. So here we took 2 approaches. So one was basically the preliminary assessment using the Washington Group, but also next phase, which would then look at a little bit more diagnosis in terms of what is the limitation and what is the difficulty. So mainly the age group was 5 to 17, primary 3, and what is the challenges which we looked at. So that was, and this involved 1,560 children in these 10 schools. Yeah. Next slide, please. So the findings here was primarily so if you look at the chart here, it shows mainly children who the percentage is a bit high if we look at from the other samples. So the proportion of visual, hearing, and physical disabilities are 9%, which is largely in line with UNICEF expectations of child populations. But as like what Daniel was saying, there were some challenges in looking at non-sensory and non-physical difficulties. So emotional, learning, and behavioral difficulties were much. So that was recorded at 37%. If we per se look at the findings here, it was astounding 38%. But if we minus out the behavioral and learning and other difficulties, visual, if you just take visual, hearing, and physical, then the percentage was 9%. So we did a little bit more analysis of this, wherein so that's why I said we went into the second phase of diagnosis, where we took a sample of 18% of the total 1,560, and that was also within that. So within that, for example, 77% of them reported to have difficulties related to visual, hearing, and physical. So that is actually concurrent to 9% of what the overall children with difficulties that we identified. So again, this gives a sample of the prevalence, wherein we now are intervening in all the 30 districts. So it was helpful for us to look at the program design in such a way that we targeted roughly around 9% and then looked at the others who have behavioral and other limitations as well. So it's a very effective tool in looking at sampling, and then if we have to scale it up to a wider extent, and then related to that the appropriate interventions. So we now have SNACOs, for example. So we call them as special needs assessment cadre. So they are the volunteers who actually support in the schools for specifically reaching out to children with difficulties, learners with difficulties, and then linking them back to the schools and supporting them at the school level for education. So Malawi, this was a much smaller example where so the program here is primarily focused on unlocking talent through technology, which aims to improve numeracy and literacy of early learners through provision of digital education technology. So here, digital education technology. So we have iPads which have been provided to children for learning, and through digital learning, they are able to interact and catch up with literacy and literacy lessons. And this is also in the local language. So it's in Chichiwa, and VSO works across the country in many schools to reach out to children from marginalized communities. So it is very important here to again identify learners with disabilities who have diverse needs and inform staff for equitable access to education. So the Washington group of questions was very helpful here. We sampled it in 2 schools in Mangachi district, where 353 was the sample size. So the findings, if you look at this, 353 surveys were completed in 2 schools, 5 to 17 years. Overall prevalence identified is 19%. So again, let me tell you these all the 3 countries where we did, the national prevalence is very low. It's as low as 2% in Nepal, 4% in Rwanda, and again 4% in. Here we found 19%. So again, this we also did a secondary level kind of confirmation to the medical aspects as well, and this was confirmed to be 19% itself. So that taking the cannot do at all and a lot of time difficulty, that cutoff what Washington group of questions the group itself advised as guidelines is very helpful, because that gives a benchmark for identifying disabilities, and again it gets validated through the diagnosis. So that's been very helpful. Next slide, please.
Yes.
So what have been our learnings and how we're looking at it moving forward? Basically, it's a great tool for raising awareness and gathering ownership among stakeholders. So when I mean stakeholders, it's both within the organization and our partners and government and other management committees. And when I mean raising awareness, it's more of building awareness on issues of disability itself within the organization and the communities where we work. So we go with this tool, and people are also excited, and they start asking questions, and there's a whole debate around issues of disability itself. Although that we don't use the term but around surrounding that whole process, it has proven more effective. It helps in identification and monitoring. As I said, in the sample target group, we can get a generic prevalence, but also it helps in identifying the primary actors whom we want to reach out to, whom we want to engage as part of our program. It's a great impetus for policy influencing and advocacy. And just to give an example here, we in Myanmar, for example, we have education program, but we've also worked with the Department of to include the watch sample survey of. So that's also proven more effective. So how we use these tools for advocacy and policy influence. The second major part is capacity development. A lot of training is required for the team who's going into the process. It's always advised that you add on the Washington group of questions as part of other surveys and not do as that it builds on and gives you the actual time and methodology is also important. When do we time it? Because when we particularly do it in schools, we need to look at whether the schools are in holidays or the children are around, and so it takes the administrating the tool doesn't take much time, because it took for us around 8 minutes in Nepal to 15 minutes in Rwanda. So that's the kind of time span that we are looking. And the third area is administering the tool itself. It requires additional time and budget allocation. So when I mean additional time here, it's basically the training and the data analysis, bringing that whole process together. And we found translation and data collection process also is very important, because in Nepal we did it in Nepalese, in Rwanda it was in Kenya, Rwanda, and in Malawi it was in. So the translations and getting people to understand that whole process. So we need to be mindful of that. And moving forward, as I said, in VSO we have adopted, and it's an organizational decision that we will be using the Washington group of questions short sets across all our research, all our programs. And when it comes to disability-specific intervention and children, we'll be using the child set. And so that's, and as again, just to conclude, as Daniel said, it's important as a comparable tool, but also it has helped us organizationally to increase our reach to people with disability. So in the first quarter this year, when we did COVID response and other interventions, we have reached 7% of the total population that VSO has reached overall. So it gives a wider horizon, and it builds people's awareness, it builds more robust monitoring. I will leave it there, Kim, and if people have questions.
Okay, yes, thank you very much. I will stop sharing my screen already and then go back to the chat. It was really nice, interesting presentation as well. Thank you for that. To hear more about like the Washington Group questions in education programs, and then also with the examples of Nepal, Rwanda, and Malawi. And that also you explain that it can serve as kind of a framework to start from or build from upon. Before I will check the questions and also the questions that were sent before, maybe it's interesting to, because I know that was one of the questions from the registration form as well, and you elaborated on that a little bit, is the fact that you have a difference in the questions for children in the Washington Group questions, and then just the question, so to say, for adults. Could you tell a little bit more about that, please?
Yeah, so the extended sets question go a little bit more in detail, wherein it's more of an inquiry, and a lot of questions are associated with looking at assistive devices, whether has assisted and those and it's also related to some of the needs. So more in-depth kind of analysis. Again, for children, you look at more aspects of how they're able to cope and so on and so forth. But yeah, the short sets are very short. They're just the 6 questions which can just give you a overall kind of.
Yes, thank you. Thank you for that. I'm just checking the chat as well. I see that one person responded that she could not see the slides, so I hope that was just this one person and that it worked out well. If not, we will also send around the slides of the presentations afterwards, so you can also have a look at that and the recordings of this meeting. Let me see. I see that someone else saw them, so I hope it was not as big of a problem. Let me see. One question from Krishna. She says, a wonderful presentation. Praveen, my curiosity to know more with you is what difficulties did you face while using the Washington Group set of questions to age group 6 to 19 years children? When Daniel mentioned that one of the limitation is to identify or count children below 5 years of age and 6 to 18.
Yeah, so one big challenge that we saw was, since it was done in the schools, it was under the teachers or the parents in some instances. So how it is interpreted and understood is one of the challenges. That's where the training of the enumerators is very important. And when it is done, so most of the time, we have also come across responses saying that, okay, the child has difficulty in learning, for example. So, but learning is very broad. So then we say, okay, if you probe in a bit, then the aspects of behavior comes. Slow learners, those kind of issues are there. But that's the reason why we see in Rwanda, for example, the percentage is a bit higher. So yes, definitely it is a challenge, but that's where the training is important and how we administer it, with the teachers being around or the parents over there and so on. So you validate and then you take those responses.
Yes, thank you. That's very clear. Thank you. I see, as I said already, that I'm a bit behind schedule. So let me just see if we have time for just one more question, if that's okay with you as well, Praveen, and then go on to Daniel's the last presentation from Daniel. I see here a question from Heather that is asking, what happens if government survey or census deems someone non-disabled and the Washington Group questions identify they are disabled, or vice versa? How can you manage people's expectations? And then she mentions as an example, if Washington Group question says people are disabled, they may expect certain benefits, which they won't get if they don't pass governmental criteria for disability. Do you have any? Could you elaborate on that?
Yeah, it's a bit tough one, but it's in a way good, isn't it? Because if someone who has a lot of difficulty and who cannot do that particular domain or it says cannot do at all, then it's a part of advocacy. So I would say it's a good point wherein when he or she is deemed non-disabled by the government sources, and then you say that yes, this person has a difficulty, then it's a point of advocacy where the individual needs to be go through that whatever the local processes are, and then get the identification done. So those cases do happen. That definitely happen, and we need to be aware that and expectations also. So as you rightly said, people's expectations are related to benefits and their entitlements and so on. So managing those expectations is also important. So we have to go through a ethical process for using the Washington Group and say that why we are doing this and what one can expect or cannot expect. So that definitely needs to be a underwriter to any of the research and in particular the Washington Group.
Yes, thank you very much. Really clear again. Again, I really liked the presentation. I'm afraid we have to go to the final presentation now. But
sure, thanks, Kim. Yeah, thank you.
Yeah, and thank you also, because I know from over there it's pretty late already. So it's really nice that you still wanted to join here. So thank you again, Praveen. So with that, I will move on to Daniel's last presentation, which is more on the tips and tricks. If I'm correct, Daniel, you also mentioned that with some of the questions in the chat, you would also really like to answer or elaborate upon. So again, I give the floor to you. Thank you.
Sure. So yeah, some of those were great questions to Praveen, and I'd like to add my 2 cents on a couple things in particular. One is with this last point that was just raised about people's expectations. Remember, the data is collected differently for different purposes in different ways. So if a school is trying to identify the needs of their students, it's not as if the students even need to receive a label of disability or told that they have a disability. It's like we're trying to assess these children, we're trying to assess what their needs are, and we're trying to figure out how we can meet those needs. I mean, it's not as if the child has to be given a label of disability. As a matter of fact, the label of disability in that situation is usually not a good idea. Usually, the reason it happens is because it's the label is needed for programmatic purposes. Oh, the money follows the label lots of times. People should be informed about what's going on. In a house-to-house survey, example, you're collecting information about the population. You're not telling these people, oh, we're going to identify you as having a disability. That doesn't happen. And then, going back to was it Rwanda, I think, had a 38% rate of disability. I know that some people were probably thinking, oh my God, that was so high. Are these children really disabled? And again, I feel like I'm, beating a dead horse, but again, it goes back to the purpose identification. You shouldn't come to this with some preconceived notion of what disability means to you, right? These were 38% of the children were having difficulties that were getting in the way of their learning. Now, those behavioral difficulties could have come because of some, let's say, psychological condition. Those behavioral difficulties could have come because they're having problems at home. They're stressed with their parents' marriage. They're running out of money. And the child is coming to school. Maybe the child didn't have breakfast that morning. And the child is coming and is behavioral problems. Now, if the purpose of the data collection is to identify children who are having difficulty doing the things they need to do to succeed in school so that we can address those problems, I'm fine if those children are identified by those questions, right? Now, are those children eligible for disability benefits? Let's say there's cash benefits for children. Well, maybe no, right? Because eligibility determination for a particular program is going to have its own conditions. That disability cash benefit program might be designed for people with very severe disabilities, or people specifically whose disabilities are clearly linked to a medical condition. I mean, however that program is designed, right? So in the United States, for example, roughly, I think I might be off by a little bit, but roughly 12% of the children in school are identified as having some sort of special need, but only like 1% of children get cash disability benefits, right? So again, it always goes back to that same thing. Why are you identifying them? How are you going to use the information? And you have to be very clear about that in your own mind to collect the data right and use it properly, and also to explain it, to whether you're explaining it to policymakers or whether you're explaining it to the public, or whether you're explaining to DPOs. If you have a clear idea of what you're doing and you can frame it that way, then I think people can understand. And then Praveen mentioned translation, and translation is really, really important. I mean, these, all survey questions, a slight change in wording really can dramatically affect the responses. And there's no way of knowing if your translation is good unless the translation is tested, and it's tested in what we call cognitive interviewing. So first of all, the Washington Group has a translation protocol. Translation and back translation don't work well. For example, I'll give you an example. This is not a Washington Group question, but it was one of the questions that was used in the development of these questions. They asked a parent if the child has difficulty walking around the house. Now, when we did this in English, the question worked fine. When it was translated into the local language, it was translated as, does the child have difficulty walking around the circumference of the house? And the parents were like, what a stupid question. Why, who goes outside and walks around the house? But when you do translation and back translation, it worked fine. Around the house, it got translated to whatever word was in the other language. And then when it got back translated back to around the house, and it looked perfectly fine. But when we did the cognitive interviewing, okay, we found out that we had to say walking across a room. When we said walking across a room, then we got at the concept that we're trying to get at. And I've seen these questions get mangled. Like, for example, in one African country, they didn't like the question, do you have difficulty walking or climbing steps? Because they said a lot of the people don't have steps. They don't know what you're talking about. So, okay, so how are we going to change the question? They changed it to, do you have difficulty walking or climbing trees? Now, climbing trees is a lot harder than climbing steps. I mean, you're going to get a really high rate of disability if you catch everyone has difficulty climbing trees, because they focused on the word climbing. They didn't focus on the concept of what does it take for someone to climb a set of steps physically, right? So in the translation, that's what we need to do. We need to clarify the concept, the level of functioning we're trying to get at, right? Then translate it into the other language, and then test it to make sure that it's that what we think we're asking is what we're actually asking. Another example, in the development of the child functioning module, we tried the question, do you have difficulty hearing? It worked fine for the Washington Group short set, right? But it didn't work for the 5 to 17-year-olds, because when we asked the mothers, because the questions are designed to be asked to the mothers or the caregivers, a lot of the mothers were saying, oh, my child has a lot of difficulty hearing. I come home from work and I say to do her homework and she just keeps watching TV. And because they were hearing as listening to me. Okay, so we had it for the child functioning module, we had to change the question. Do you have difficulty, does your child, have difficulty hearing things like sounds and music, or I forget exactly how it's worded, but with the prompt of music or words or something like that, then the question was working. And so if we hadn't tested the question and we just used the Washington Group short set question to mothers asking about their teenagers, we would have seen a surprisingly higher rate of hearing difficulty among children in that age group. And that's why the child functioning module, the questions are more designed both for children and also for domains like playing, which is really important for children, right? And staying on task, which is a real activity, which is very important. Not being able to stay on task for children in schools is really associated with developmental issues. So always go back to the purpose and always test them in your local context. Even the word some, no difficulty, some difficulty, a lot of difficulty, cannot do. We find there are challenges in translating the word some. And we've been in countries where people argued back and forth. No, this is how you do it. No, this is how you do it. And we always say the same thing, test them both and see if it works, because sitting in a room by yourself, even with your colleagues, you're not going to catch things. Like for example, do you have difficulty walking? Yes or no? We had wheelchair users saying no, because they don't walk. How can I have difficulty doing something I don't do? Well, if you're not a wheelchair user and you're trying to write a question, it seems perfectly clear in your mind. And if you ask somebody if they have difficulty walking and they can't walk and they use a wheelchair, they're going to say yes. But no, when we have the scaled responses, no, some difficulty, a lot of difficulty, cannot do, then they see themselves and they cannot do. Oh, well, I can't walk. And so they respond that way. So these things are very, yeah. So I'm just going to keep repeating myself. So I didn't think I was supposed to have a second presentation. I thought we were just having a discussion afterwards about things. And I think there were other questions in the chat. So I think we should maybe just go to those questions.
Good point. Yeah. Also, looking at the time, that's even better, I think.
Okay.
Maybe glad you also elaborated on that. Maybe also good. I think it was also one question in the chat, but also it was asked multiple times during the registration form. So I just want to mention that one as well. Also looking at the news now, of course, was about COVID-19 with regards to the Washington Group questions. And so I have multiple questions on how can the Washington Group questions be adapted to collect detailed disability data during pandemics such as COVID-19. Could you elaborate a little bit on that, please?
Well, again, if you're just talking about identifying people with disabilities, it's the same questions, right? And then you could ask additional questions about what the impact is. Have you been able to get your wheelchair repaired? Have you been able to get your hearing aid battery replaced or whatever? And how has that been affected by COVID? I mean, you can ask additional questions, but the questions to identify the population of interest are the same. The big issue is phone. Right, because right now in a lot of places, people are not going to be happy if you knock on their door and want to talk to them face to face, or it'd be hard to get an interviewer who's willing to go door to door and talk to everybody. So more data collection now is occurring over the phone, and that has several issues. One is sampling, because not everybody has a phone, and the second is the accessibility of phones. For example, if people who are deaf aren't going to be able to use a phone as much, right? So you have to think about that. And if you go to the Washington Group website and you go to the blog section, we have it. Actually, I think this might be our most recent blog, or maybe it's one of the most recent blogs that talks about phone surveying and issues involved with asking the questions over the phone. So if you're interested in that, that's what I would recommend. I would recommend to you to go read that.
Yeah, thank you. I think Praveen raised his hand. Yeah.
Yeah, can you hear me?
Mm-hmm.
So just an example, in VSO, we used Washington Group of questions post the pandemic as part of our rapid assessment survey. So again, in Nepal, when it was used, we identified 2% of so it was a small sample. Again, as Dan said, yeah, we can't do a huge and what we have. So out of 1,000, at 2% were identified. But again, there were limitations because we can speak by phone, but most of the places in rural areas, particularly, people don't have a smartphone, and henceforth. Deaf people do get left out. Multiple people with multiple disabilities do get left out. We can reach to people who have physical disabilities and visual disabilities, but yeah. So those are some of the challenges. But yes, it was helpful in identifying, which otherwise I would say would have been difficult. But and then some of the issues also. We need to look at the intersectionality. I think this also came up in one of the questions where. Got the double layer of vulnerability and issues of gender-based violence amongst women with disabilities also came up and so on.
Yeah.
Yeah.
Thank you. Yeah. Yeah, thank you for that addition, Praveen. I don't know, do you want to respond or reply to that, Daniel, or did you have some other questions maybe from the chat to look at?
If we can go to another chat question, that would be good.
Yeah, sure. We go a little bit up to see a bit before what one of the questions was. Let me see. Let me see. One of the questions is by Deepa. She's saying, are these tools being implemented directly by the government departments in any global South countries, even if in partnership with international organizations taking lead to implement Washington Group Questions model in particular countries?
Yeah, I mean, a lot of countries have incorporated these in their census or their surveys, even in national disability surveys. For example, in Vietnam and Thailand just used the extended set and the child functioning module in their national disability surveys. In South Africa, I know the Washington Group Questions are in multiple surveys in many countries. The MIX, Multiple Indicator Cluster Survey, which is UNICEF's survey of family well-being, used the short set for adults and the child functioning module for kids. It was conducted in 70 countries. The World Bank has used the Washington Group Questions in at least 50 or 60 or more surveys. So that they've, at this point and over the last few years, these questions have been used quite a bit, both in national statistical systems and in surveys by development agencies, and also by researchers, you know, and also by some NGOs running their various projects as well. So we have a wealth of experience using the questions, and usually they work fine. Sometimes there's some issues, some difficulties, but that's true for all questions. The biggest problem we have is people who say they're using the Washington Questions, but they're not, because they use the questions, but then they change the response categories to yes, no. Or they do something like say, do you have a disability? And then if the person says yes, then they ask them the Washington Group Questions, which doesn't make it completely undercuts the whole idea of how they're supposed to work. So sometimes when someone says they're using the questions, you have to go actually look at the questionnaire. Or sometimes they'll do things like, now I'm going to ask you some questions about disability. And then they ask the question. Well, once you say the word disability, you're going to change people's mindset and how they answer the question. So they're used correctly in many places. They're also used incorrectly in other places. So whenever I see any study on disability or any reporting disability, the first thing I want to know is what questions did you use to identify people, and how was it administered? And before you can even begin to interpret what those results mean.
Yeah, thank you. Yeah. Let me quickly go to another question, which was asked by Annet.
Just one addition, Kim.
Sure. Sorry.
I think 80 countries around the world are in some way or the other using Washington Group of Questions. So governments of 80 countries.
Yeah, thank you. Yeah, that's good to know. The next question also elaborates on both of that, I guess, a little bit, but to what extent the Washington Group Questions are already adopted by governments in their census, is a question from Annet.
Yeah, if we don't have a complete list, but many countries have. If you go to the Washington Group website, there's a list of countries that we know that have done it, but that's not a complete list, because we're constantly learning of people who are using them in various contexts. But on the Washington website, you can. And if you're interested in a particular country too, you can even contact the secretary, though they might get angry at me for sending a lot of people. but there's a list of an incomplete list, but a list on the website.
Yeah, thank you. Yeah, Praveen, did you want to reply to that as well?
No, I'm okay. Sorry.
Oh, sorry. I thought you was, yeah. Okay, good. Yeah, thank you. Yeah, I have one question here, which is maybe more practical, but also a really important question, I think, is from Sechin, if I pronounce that correctly, I hope. What kind of adaptations need to be made to ensure that people with deaf blindness are included in data collection?
Okay. Well, people who are deafblind are identified by the Washington Group Questions. There's not a question, are you deafblind? But there's a question on vision and there's a question on hearing. So we say, people who have a lot of difficulty or can't do both of those things are deafblind. And there was actually a study that was done about using the Washington Group questions on the deafblind population. The author was Islay McTaggart, I-S-L-A-Y. Her last name is McTaggart, M-C-T-A-G-G-A-R-T. If you go to Google Scholar and search on Islay McTaggart, deaf, blind, disability, I think it was in India and Cameroon were the two, I believe, were the two countries they worked in. But there is one study looking at the Washington questions in particular with that population and how to define them and what the results they had. So we have at least that one study that was done on this issue.
Yeah, in that exercise, I think the enumerators were trained on tactile sign language, and also Braille was administered in terms of for self-responding.
For self-responding, yeah. In a lot of these issues, we have proxy respondent. In most household surveys, the household head answers for everybody. But again, depending on the situation of where and how the questions are being administered, are you dealing with proxy respondents? Are you dealing with, individual respondents? Are you dealing with parents of children? Again, each situation is a little different.
Yeah, thank you both. I'm afraid we just have time for one more question, but then I will we'll also tell a bit about maybe the option to have more questions answered later. But maybe one more from Deepa, who mentioned, can you explain the mode of entry to a country where Washington Group questions is not being used yet? India, in my case. How do we get trained as an organization if we need to implement this in our program?
Yeah, we've had resistance from India on this, on these questions. And I think a lot of it has to do with the implications for what the prevalence rate would be. Because in the India census, I think it's a roughly somewhere between 2 and 3%, like 2.5%. And I think that if you use the Washington questions, it would be higher. And sometimes you have this problem with countries. They don't want that higher rate because they think that they're supposed to be providing disability benefits to all those people. And it's going to break the budget. It's going to raise expectations of what's going to be provided. And they don't like that. So you really have to prepare people about what you're collecting, about this threshold idea. So for example, the United States, 15% of the population has a disability, only 2 or 3% of the population is receiving disability benefits. But those other 12% are still facing barriers to participation that maybe aren't going to be addressed through some disability pension, but should be addressed in other ways. So you have to, so in that sense, you have to prepare the country for that range. That's why I hate the one number. I wish people reported it as, 3-4% of the population has high support. People with disabilities have high support needs, and there's an additional, 10% who have could really benefit from assistance and whatever. And then there's, if it was reported where that continuum was at least addressed, I think it would have helped people, accept some of these rates of disability without the fear that it's going to break their budget.
Yeah, thank you. Maybe just like a very short, small, on a small note before I go to the closing, is maybe you could briefly also tell how organizations can get training or find the resources for it. Is there, we can also make sure that this is sent out later.
Well, the Washington Group itself does trainings for, usually has done trainings mostly with National Statistical Office, but have done trainings for DPOs. If you go to the website, you'll see a lot of the training materials. You'll see some videos of trainings and some, various documents. We also provide technical assistance to NSOs. And if there's if you have particular questions, you can always write to the Secretariat. It's WG_Secretariat. Well, if you go to the website, there's the address of the Secretariat is on there too. So it's Washington Group, disability.com. And there's a whole page about trainings and training materials. And if you have specific questions about the methodology or anything, you can always write them to the secretariat, and it's like a help desk, and we'll answer those questions.
Yeah, thank you. Yeah, that might be good to mention still. Well, I'm very sorry we have to leave it at that. We're a bit out of time already. I will just quickly ask Hanneke to show a last slide with the contact details from both of our sites, from DCD and the Leave No One Behind platform. Yeah, I want to thank everyone for their participation, and especially, of course, the presenters. It was a really, really nice webinar, I think, with a lot of food for thought, which I hope the rest of you agree on. It's good to show you that, yeah, here on the slides are for both the Partos Leave No One Behind platform, but also DCDD, our contact details. And as I mentioned, afterwards, we will also share the recordings of this webinar, as well as a Q&A. We hope to include also the questions from this chat and see if maybe one of the presenters or some of them have the time to answer just a few of these questions still. So we can also help you out with that. We were also thinking of sending out a survey to just see whether you guys are interested in maybe having another sort of webinar on this topic, and maybe then more a bit of interactive, maybe with breakout sessions, or where people can really interact and elaborate further on this topic, which might be interesting. And also, of course, provide us with feedback on how we did and how we can do better. So make sure to fill that out as well if we send it around. And as I mentioned, that Linda, our research intern, will also send out guidance note on disability inclusive data monitoring. So that might be an interesting option to check out as well once it's there. I think very briefly that was it. I just have a check with the other presenters as well as Partos and my team if there is anything I might forget. As Lieke mentioned, you can reach out at dcdd@dcdd.nl if you have still any questions left. Yeah, I'm afraid we have to leave it at this. Otherwise, we're already out of time. So thank you all very much, and again, thank you especially for all the presentations. Daniel, thank you. Praveen, thank you, and Annette, who I saw already had to leave, but a big thanks to her as well, of course. So yeah, I'll leave it at this. Thank you all, and hope to see you around next time online. Bye-bye.
Bye, everybody.